Hello and welcome back to Bump Love. Yet again, this beautiful ambience is courtesy of Aleph Cafe and Restaurant, where you can come, have a morning coffee, have an afternoon tea, have a drink and good time with your friends. In fact, if you hear any clink, clanking and any noise that's coming from around us, there is people having some good times here, so you might hear an occasional laughter, ha ha ha. Or you might hear something going on in the kitchen that's hitting, there's a special cocktails being made. So don't be afraid to come and indulge in one of those at the Aleph Cafe and Restaurant. So today, I think you can see that we are joined by a guest, yes? We talk about our reproductive health. You know, reproductive health as women is such a big factor embodied in our overall well-being, and yet half the time we don't even know what's going on into our bodies. So we decided, well, why not get a specialist who can help us navigate our experiences, one, who can also help us separate fact from fiction, and as well as guide us on how we can improve our reproductive health. So today we are joined by Dr. Kisuule. He is a seasoned specialist gynecologist with 12 years experience as a medical practitioner. He is also the CEO of Alexandra Medical Center. And you know, when you have big profiles, people have to read a few things. Yeah. He also heads the high-risk pregnancy management unit at Nsambia Hospital, where he is also a consultant. In short, he's the right person for today's job.
Yeah.
He is happily married to one Alexandra.
Yeah. If people haven't understood, he's the CEO of Alexandra
Hospital.
And the wife is
Alexandra.
Anyway, moving on.
And together they have 3 children. You are so welcome to the show, Dr. Kisuule.
Thank you, Pumla.
It's been such a battle getting a doctor here.
Yeah.
You know why? I think it's because of their personalities.
Yeah.
They like to work. Yeah, they just want to be behind the scenes. They don't like Katara.
Yeah.
Of Manuela could never be a doctor.
Right? No,
Wow.
Behind the scenes, why? Why are you keeping me the other side?
Pumla, I don't know. It's like as though because I pick on you, now you've come for me today.
Hey.
What's up?
It's Dr. Kisuule's day.
Yeah, it is.
Yeah. So, doctor, there's so many questions that people have and want to be answered. One of them is, what are the few things that women need to consider when thinking about vaginal health?
Well, thank you very much, and thank you for inviting me to the show. So things to consider when you're thinking about vaginal health is actually it's a very important topic, because that area is a very sensitive and good area that needs to be kept healthy.
Good area.
Cutting.
I told myself this show, the ones I'm going to are different from what people are saying. But moving on,
No,
it's
it's
a
true,
good
because
area.
empires have fallen because of that area.
That's what she says.
Yeah, and of course we also go to school and study for 10 years just to manage that area and everything related to reproduction.
It's a powerful, it's a
It's
powerful.
a very powerful area. That's right. So taking care of it is paramount, and we need to take very good care. And one of the things we do is, taking a bath every day, because it's very important, and we don't think it's obvious to everybody. Yes, because tubalaba batanaba. And from experience, so it is important that at least we take a shower once or twice a day, and because we take a shower, generally we'll be in a better state down there as well. As we take a shower, we use soap, and in that area on top, it's okay to use some soap, but no soap goes inside. Because inside is supposed to be the self-cleansing area, because yes, we say the vagina is a self-cleansing organ. You don't need to do so much to make it clean. Just a little bit of water is enough inside.
Dr. Castro, I think you should say that again. You know, when people see my nails,
Yeah.
they ask me, how do you clean down
yes,
there?
they
I'm
like, they
I
have
don't
that
fix
question.
my fingers
Yes,
inside
yes,
there. Because, and they're like, why don't you fix it? I'm like, I don't douche. You don't douche. Anyway, I'm not that doctor, but tell them for me. But you know, like asking in the comment section, all those nails are so long, oh my gosh, tell them.
But you should clean them, but just not with soap.
Yeah, but I don't think like that.
Okay.
Nails are
It is okay, but having long nails has its issues, by the way.
doctor, you're not
I think let's
talking
go
well.
there. I think let's go there.
Should we go there?
I think since we opened the Pandora's box.
Your conversation is not
Since
good.
we opened the
Your
Pandora's
conversation
box.
is not good.
So tell us about those long nails and their limitations.
So the issue with long nails, I mean, they look nice, you may look good for people, but it's not good for health purposes because you know there are lots of areas you don't clean under that area.
Okay.
So
That's why the fake ones are good.
well,
Leave me alone, you people. Leave me alone.
But you're not
Today is not that day. Today is not that day. Mama, doctor, continue with the conversation. I don't fix it. Mama, we continue.
yeah, so the main thing is not to put soap inside.
Yeah.
Right? When you don't put soap inside the area, because that area is managed by good and bad bacteria, they keep some kind of balance. And when we keep that balance, we keep the area where it's supposed to be and how it's supposed to look like. So it's important that everyone knows how to take care of that area. Not for the many reasons we've mentioned before, but at least for, to have a good vaginal health.
Yeah. Is there any relation with hydration and good vaginal health? So with
Yes,
drinking water and
yes, drinking water and many other things actually. Drinking cranberry juice, drinking
yes.
water, drinking yogurt, having healthy meals, fruits, vegetables, all helps to keep that area moist.
Yeah.
And it improves vaginal health. Now when Pumla says moist is good, it's not that kind of moist, but I mean it's the general it's the general one.
We are going to struggle. Me, Manuel and I feel like we struggle through this show. I feel it's difficult for us to separate.
I think the doctor needs an extra glass of water.
When should one consider visiting a GYN? Is it after conception, or you could just choose any day and choose a GYN? And what do you consider when choosing your GYN?
Okay. So I'll start with the first question, which is easier. When should someone visit a GYN? I think so as a GYN, we usually treat many kinds of people. We treat a girl who's young, a baby who's 2-3 years having some abnormal discharge from down or bleeding, can come see us. We can have a 65-year-old woman who has menopausal issues coming to see us as well. So there are a range of issues, but within this group of reproductive age, yes, from about 21 or when someone becomes sexually active, they need to visit a GYN for different reasons. It could be contraception, family planning, abnormal periods, irregular periods, painful periods, how to prevent a pregnancy, and what to do when you get pregnant. Yeah.
Oh, so speaking of I see you said 21. Are you allowed to give advice on contraceptives to a minor? Because you've said that when you start having sex or having sexual intercourse, but by law, girls are not allowed to have sexual intercourse. So if I came as a 16-year-old and I honestly needed reproductive health education, and would you advise me, would you accept to give me a contraceptive? Yet I'm below the sexual intercourse legal age.
That's a good question. It's also very controversial, Pumla. The issue with it is, in our country, we don't have specific rules and laws around it. But we borrow a lot from the UK. And in the UK, there's the Gillick and Fraser competences. They come out of a case that happened many, many years ago. About a woman who sued a doctor for giving contraception to her 16-year-old girl, which was also below the age of... so it went up to Supreme Court, and the law there suggested that, or stated that if a person is having sex and they're not going to stop having sex, and they've made the decision at that age to continue having sex, and you deem it fit, they're not going to stop.
Yeah.
And then their rights, a sense of mind, then it's okay to give them contraceptive advice. And you would encourage them to tell their parents, which is a bit hard. Now, when you come down to Uganda, we have a lot of teenage pregnancies, actually.
Yes.
1 in 4 girls in Uganda currently has been pregnant before the age of 19.
What?
Yeah, so if 1 in 4, this is 25%, have been pregnant before the age of 19, means that many more are having sex.
Yes.
All right? So we cannot pretend that these things are not happening. Okay, they are happening, and therefore it is a pertinent question. Should we shy away from contraception in the teenage, or should we face it head on? So those are the challenges. I mean, Parliament is having sex education and things like that. But ideally, we would provide some kind of contraceptive knowledge in a safe space for teenagers who we deem fit. That, you know, these girls, instead of pretending they're not having sex and not giving them contraception, they're going to end up in abortion clinics because they're going to be pregnant and aborting. So then if you give them contraceptives to prevent pregnancy, it may reduce our abortion rates, which are very high, by the way. We have about 250,000 abortions every 4 years.
Registered or known, but there are those which are hidden. There are those.
Well, if you count all of those, every 4 years we make 1 million abortions in this country. So that's the kind of thing. So then the other question would be, then would you provide contraception so that people have options, and will they have more sex with contraception? So then that's the dilemma.
Exactly.
But I mean, that's around that.
I don't want to be in your place.
I know, right? So, doctor, you talked about cleanliness, hydration, and all of those things to ensure good vaginal health. Now I'm ready to come and see the gynecologist. What must I absolutely do to make both of us comfortable?
Okay.
Yeah.
So
I know, right?
Because this is a private part, I'm coming to most likely a male who is not my brother's, cousin, or you're not known to me. You're a stranger, and you are going to be. I'm going to have my legs. Yes.
Yeah, that's true. So it's important that you choose the right guy, and not every good guy is your right fit guy.
Oh, yeah, that makes
sense. Is your
sense.
perfect fit. Many people choose guys according to their parents. Mommy went to this guy. My sister went to this guy. They're a good guy. Go to that guy. The other one is go to this hospital. They are usually good. The hospital is big, and then if you choose a guy from that area. And then you have people also saying, I have my friend's guy was a good guy, so then they choose. But I mean, whichever criteria you use, when you visit a guy, you should be very comfortable with having them in a professional way. Because these days, patients may be comfortable in different ways. But it's important. It's important that we get, the right comfort in a professional way.
First.
So one that gives you enough information, the one that you feel safe under, one you feel that will address all your needs, and not all your needs per se, but all your needs in the medical. In the medical
How did you see where I went?
No, just to make sure that people's minds don't go far. So it's important that, I mean, if your guy ticks all those boxes, some
so
go to
start with
gyns
like a
because
consultation to get that sense of comfort.
Yes. Well, you may start with your insurance. My insurance doesn't go to this hospital, then so then you're limited to this hospital. Then this hospital, you'll choose a guy. Is it a male guy? Is it a female guy? There tends to be more male guys than female guys, but that's another topic.
I wanted to ask that question. You are too many. You are too many.
Yeah, that's true. There are many men.
All up in our business.
That's right. And truth be told, the men are the experts of gynecology. Not to demean women, but I mean a lot of doctors in the olden days were male. Okay, so then female doctors came later.
By design.
And also the nature of obstetrics and gynecology is very taxing.
Say that word again.
Obstetrics.
Say it again.
Obstetrics.
Obstetrics.
Okay.
Obstetrics is to do with OBGYN. OB,
yeah.
Let's skip to OB because that word disturbs me. It's like anesthesia. Anesthesiology.
That's right. So usually the nature of work for an OBGYN is very taxing. You have no nights, you have no days, and most women want to have some kind of family life. So then they would shy away from specializing. We have quite a number, but the men will tend to be more.
Makes sense. That makes sense.
So then there are women who choose to have a male gyne. From the go, they'll say, for me, my gyne has to be a male. Women are not compassionate. Women say this, they do that. I mean, they have ways in which they justify why. And then the man will understand me. He's caring. He's this. I mean. And then the people say, me, I don't want a man to look down there. It has to be a woman because she knows what I feel and what I go through.
She knows what's there.
So whichever criteria they use, once you feel comfortable with your guy after the first consultation, that will be good.
And I think for Rachel, when it comes to people who, I think because by nature of personality, some people just like, I'm going to open my legs to somebody else. That thing which you said earlier of consultation, I think when you're going to see a GYN for the first time, it should not be that you need to expose yourself that first time. That you should first speak to them, and then you kind of feel if you are right fit for each other, and then if you feel it on that day, then great. But if you don't feel it, it's okay not to have that issue. Like, don't go when you have an issue that needs you to open your legs when you're going to see a GYN for the very first time. I think that should be able to break that barrier, that ice.
Yeah. Okay.
So like, are things like shaving important? So obviously you have to bathe that day. I know you said it's not obvious, but please.
Yeah. Also, when you're preparing to visit your GYN, what should you do?
You know you are going to open your legs.
Yeah, so it's important that first, okay, so not all visits with a GYN will end up into that kind of examination. Okay. But if you suspect that it may end up in that kind of consultation, i.e. you've had this swelling down there, you feel like the doctor may need to see it, then it's important to keep that area clean. Please take a shower before you come. Wear a nice panty. Not that we'll see the panty, but
nice panty. I do it, but I've never known if it matters.
no, okay, presentable is what I mean. A presentable.
You don't start explaining. Sorry for the whole.
Yeah.
Already you're uncomfortable. Now you have added a hole in the pants.
Yeah. Then the area should be well kept, usually. So a good shave is nice. Some people walk, it's very painful, but they may prepare for the visit a few days from time. Yeah, because then they come with lots of bumps and stuff, and you're like, okay, so sorry about that. Yeah. So it's important to keep that area nice, presentable, and I mean easy for us to see. Don't have to.
The Amazon. Oh wow. The bush has to go. Oh god.
That's right.
Oh my gosh, that makes so much sense. So there is a myth. I don't know if it's a myth, but I guess is it true that when you have a vaginal birth, your vagina expands and becomes loose? Actually, that's the word. And therefore, you have to sit in Coca-Cola. You have to sit in ice. You have to sit in, what's the other woman's name, Nakakande, who has some concoction for you to put down in there. Do you have to, like, there's this thing where we as women sit down. You are loose, Nida. Do this. We are always sitting in some car meeting about it because now we've had a vaginal birth.
Okay. Yeah, so it's a bit true that after vaginal birth, you may never be the same 100%. But you're at a considerable recovery of about up to 95%. Okay? Yeah, which is not so bad. And that also depends on many things, on how the actual birth happened and what really happened in the birth. So the vaginas are very good potential for expanding and coming back. Okay, because you can imagine a whole head of a baby coming through, and it actually gets back to almost where it was. Okay, so it depends on if you've had a tear or not. If you've had a tear, then we could usually put it back nicely. Okay. If you've had a minimal tear, it may not go back to where it was 100%, but it will be a good percentage of what it was. Yeah.
Okay. So we still need to do our Kegels.
Yes.
And while you are in the act, just to
Kegels do help.
Yes, Kegels help. Kegels are very important.
Okay, so what are the things except the Kegels? Like, what are those other things? Our Sengas telling us that truth.
Well, I don't have enough evidence about what the Sengas tell you or what things you use to tighten. I can't really be an authority in that.
Yeah.
But what I know, the Kegels, which are those contractions of your vaginal muscles, your perineal muscles, they help to firm up the area, and every woman needs to know what to do. When you're going to pee, you hold the pee for a longer time, then you pee hold. When you do that kind of movement, then you're strengthening the perineal muscles.
Because my vagina is in the gym.
Kind of thing. Yeah. Kind of. Yeah, it helps.
But then also, Manuela speaks about vaginal butts, but I was told, now what I don't remember if I was told by a specialist, so I need you to clarify this for me, that it doesn't matter regardless of whether you have a vaginal butt or a C-section, because those muscles already for as long as you get to 9 months of carrying a child, the weight of the baby loosen the perineal muscles. So I don't remember who I was told that by. So they said already the weakness starts from there. Then you add the vaginal, but there's already a weakness.
Okay, so it's not very accurate. We know that people who have cesarean sections will generally have less traumatic vaginal birth injuries because they've had a cesarean.
Okay.
And because they've had a cesarean, it would mean that their vagina will not go through a lot of what the others have gone through.
Okay.
And therefore, if it's not 95, it may be 98
Okay.
for the person who is having a cesarean.
Okay.
And that's why many people in Hollywood just want a cesarean. And even coming here, there are a few girls who come and say, you know what, I don't want anything to touch to destroy my V, so I need to have a Caesar. And we say, we go through saying, you know, it may not be worth the risk, you know. It may not be worth the risk to go through a big operation just because you want to preserve one area. But indeed, it's true that if you don't have a cesarean,
that area.
That's the area.
Then how do you tell a woman who knows that the Troy, the Helen of Troy, that Troy fell because of a woman, and you're telling her that it might not be worth the risk?
No, so and that is relative. I'm sorry, I should take it back. It's relative because indeed countries have gone to war because of that area.
Gone to war.
So yes, much as we have a cesarean, you can have it's not worth having a cesarean for medical purposes, for the purpose of preserving the vagina. But indeed, those who have cesareans have less birth trauma, and therefore their vagina is likely to keep more intact.
Okay.
There's another important issue, which is the hormone that all reproductive age women have, which is estrogen. When you have estrogen going through your bodies, which is from puberty till about menopause, 50, 51, there's a hormone called estrogen. That estrogen helps to keep that area moist and healthy.
Okay.
And then when you clock that age, that when that hormone has dipped, when it goes down, then that area becomes less moist, and you need these supplements that menopausal women require in order to keep up with your sex life and things like that.
It goes up. Pumla has told us, she has warned us, that as you get older, the drive goes...
No. It goes up for some time, but it will definitely drop.
Then it goes back down.
It will drop. It will drop.
Okay. I think I wanted to know about, you know, so you've kind of explained the 95% for my one child.
Yeah.
But Rosette has had 4 vaginal births. So she's like at 70 right now.
Not necessarily. Not necessarily, by the way. You may find a person who's had 1 child worse than one who has had 4.
Again, the
birth. You might be younger, you had 6.
I will get my references. I'll show you my reference list.
By the way, I'm very cognizant of my I know.
You do your Kegels.
I do my Kegels. I know. I would know.
And by the way, having more requests coming in for what we call cosmetic gynecology. I feel like I'm a bit loose. I want to tighten up. Yeah. And then yes, always we.
I actually had there's a lady, Nerves and Bones. Did we have her on this show once? No, maybe not.
No, not that I can remember.
So I went to Nerves. So I contacted her. Yes, we had her on the show. You just don't remember because she was dealing with different trauma from people who had pregnant birth and whatever. So she actually came and told me that, by the way, if you have a client, an audience on your show who is thinking about going back and tightening without using those herbs and soda and things like that, please come. And so I decided, you know what, before we talk to our audience, let me guys see what's up. And she actually has an instrument that measures your
diameter,
your elasticity. What do they call that?
The
looseness. The looseness of your muscles. And then you keep going back to her, and then she will tell you, madam, at 100% woman is supposed to be at this strength level. For you are at 70. But we can, as you keep coming back, we'll keep taking you to. Of course, I just went for that one time. I was good. I was not at best. I could do with some work, but I was so happy with myself. But even, she even said, but there are women who always want to be at 100%. So even someone can come here at 94. But she wants back to that 100%. And there are women, she actually told me about women who had gone terribly, like 40%.
Yeah. Oh my
Depending on the trauma, the birth trauma. the
Yeah,
trauma
and
that
if you're
you
not
had
doing
too.
anything
So
about
this is
it.
also at Alexandra Hospital.
No, we don't do that.
Maybe you
because
should.
That's with physiotherapy. So it's the same as working out,
Okay.
but now working out in that area.
Okay.
Yeah.
Actually, and they are physiotherapists.
Yes.
That
Yeah.
That
hospital.
help you.
It's a
Okay.
physiotherapist. For us, our thing is ingachiyise. There are times when you examine and you say, you know what?
No.
Yeah, this one will
Even
need
if a
to.
plane passes
Yeah.
here.
Oh,
Okay,
Lord.
we know that to some extent it's relative. It's relative to your partner.
That's
I mean,
true
some
as well.
people's parents say,
Yes.
for me, I bulungi. But you also come say, doctor, chiri bubi. So if that's the case, then we say, okay, we examine, we measure, then we say, okay,
Yes.
then we can give her a good job.
Okay. Mr.
And
Mlondo,
they've
let
come,
me
the
know.
many come that, the many that have come back say, you know what, doctor, what you did for me.
I can never thank you
Yeah,
enough.
I can never thank you enough.
Alexandra Medical Center.
So this is good.
So, Dr. Castro, lately there's lots of infertility issues happening with the women. And what can they do to improve their chances of conception? Because it's becoming a big deal lately.
That's true. And that's also a very good question. But we think that infertility has always been there.
Oh, yes.
But just that now, women are getting, okay, one, more health-seeking behavior. So they're coming to the hospital to say, you know what? And also, too, there are lots of societal pressures. You know, after 1 year of marriage, abana baliwa. 2 years, mubadechi. 3 years, to kusabide, you go to do this. So there's a lot of pressure. Yeah, there's a lot of pressure on couples to get pregnant. Whereas these things used to happen before, and women used to talk with their mothers, saying, guys, kolachino, koreri. Sometimes women would go as far as sleeping with someone else to get pregnant, and then, you know, they stay in a happy marriage because the husband doesn't know. I mean, there are ways to kind of treat male infertility. It used to happen. So now that people are talking more, there's social media, everyone is sharing here and there, it appears that it's getting more, but actually it was already there.
That's
It was
true.
already there. But speaking on that, yes, it's true that infertility has kind of increased over time. One of the biggest risks is tubal infertility. Your tubes get blocked. So, you know, every woman has the womb that is that has tubes connected to, and those tubes are the rod that leads the egg onto the sperm. Fertilization happens there, then it comes back to the womb.
Yeah.
So if your tubes are blocked, if your rod is blocked, then there's nothing going to happen there. Because then the egg won't reach the sperm won't reach the egg. And a lot of fallopian tube issues are because of infection. Okay? Poorly treated infection, and the biggest cause of infection is STDs. The biggest cause of STDs is promiscuity.
Okay.
So generally, promiscuity has increased in our society, leading to infertility. Yeah. So if you have multiple sex partners, you are bound to get these infections that cause a lot of mayhem in that area. And when they cause mayhem, you heal with scars, and that rod, which is the tubes, are going to be blocked.
It gets potholes and
It gets impassable.
yeah.
So it's important that at least amongst the things of keeping our vaginas healthy, we need to also protect sex. If you can't have one partner, you use a condom, and preferably you'd have to have one partner to prevent yourself from getting those infections.
Okay.
Right?
Yeah, or your partner having you only, because
Yeah.
the woman can have one na ye.
Yeah, that's right.
Because
But
there is
the
that
other
as well, isn't
counterpart
it?
Yes, for sure.
is on
And
a
also,
roll.
that's true. Well, it takes two. It takes two to kind of. So much as the effects will be seen in the woman, they may not be caused by her. It may be caused by the partner. And the other issue as well is 3 out of 10 couples that come to you, 3 to 4 out of 10 couples that come to you looking for a baby, the issues with the man. Yes. And this is, our society has kind of made it look like it's a woman problem. If you're not getting pregnant, it must be you, not the man. So we're increasingly informing men that sometimes it could be you. And some days men first come alone these days, say first check me to, then
Which is okay.
I know that I'm fine, then
we can bring that
then we can bring the check, which is fine. Although we encourage couples to come together, to go through this together. But we found that men are increasingly the cause of a lot of infertility
Fertility.
issues.
Yeah.
And it's big because from our great-grandfathers we thought it was 0%, but now we know it's actually 30 to 40% of men who are contributing to infertility factors.
Yeah. No, you're so right, Dr. Castro, because many times we've looked for a male to tell us their infertility story. But Dr. Castro, no one comes up. In fact, if you're there and please reach out to us in the DMs. If you're a man who would like to share your story, because of how hard it is, we really need to break this so that many marriages can thrive, many marriages can be better. If more men can not welcome the fact, but just be cognizant and being open about the fact that they could be the cause. So if you're there, please DM us. Would like to host you and have a conversation with you about infertility. Anyway, back to you, Dr. Castro.
Are you increasingly seeing, maybe in your 12 years of experience, are you seeing any statistics that indicate that more men are now coming, or are more, what's the word?
The men have always had this issue, but now they are coming out
are they now
more.
coming to you? Like, are they now seeking help more?
Yes, that's very true. They're seeking help more.
Okay, which is always a good thing.
You know, there's this societal pressure that puts on the men this pressure that you must hold it together, you're the man. And also it's brought about by the women, because the Muchala may say you're not man enough, bitchy, you're not doing this. So men may feel, you know, putting a cocoon down and not really want to come out. And when they have this issue, the wife or the partner must be must tread carefully how they manage their husband or their partner in this issue. It's important to be supportive. It's very, very delicate. It's very, very delicate, because it's a tricky one, because I have a few couples in this kind of scenario. But you know, the woman also has to go through counseling, because her in-laws think it's her, but she knows it's the husband. The in-laws don't know it is their son, and the son is just there in the middle.
Quiet.
Yeah, he's quiet.
And she's trying to protect him.
She's trying to protect him, She's trying to protect him. So, and then there are women, they know the thing, nataniko kulangira omwana. It happens. Nagamba, you know, even the other day, even this. So anyway, one issue may lead to another, which may cause an outburst. All right? So it is a thing that needs to be handled delicately and also professionally by us, because these kind of couples go through counseling.
But I truly think that both sides should be handled delicately, whether it's the woman who is the cause or it's the man who is the cause. Because also some men can really kulangira,
for sure, and
then get another chick and say, Auntie Gwetozala. So like you know,
that happens more commonly, for sure.
That happens more commonly. But I had a question about infections. There's, you know, this thing of after you've had sex, there's a lot of UTIs and whatever. You know, we're still talking vaginal health. And I remember being told, at, you know, one of the gynecologists says, immediately you have sex, pee. I'm like, the holes are different. How is my peeing going to assist? Because I did have a lot of UTIs. Because after that, you just, you know, snuggle in and it's just too much work to now get up, go to the bathroom, wash. Even your sleep, which was nice, has now ended. But I was getting lots of UTIs, and the doctor just told me, no, before we treat, from now on, for the next 1 month, every after, go pee, wash up, get into the then go to bed. We've never seen the doctor again.
Which means
but I'm sure the holes are different.
No, they're different.
Is there
but
a science?
Yes, there's science. Proximity is very close. So because of proximity issues, and you don't direct what moves where, right?
No, we don't.
The holes are different, but the vicinity is the same.
Yeah.
So that means it's a very good practice, and one of the things to keep for vaginal health is, you know, having a wash after sex. And peeing helps things that are near the area that may creep up just come out.
That is the science.
It's a good one.
It was a good science. It worked.
Happy that worked.
Do that actually.
But you didn't realize
I
that
didn't
it was.
realize, like I just can't.
So doctor, I have another myth. So let us say the Lord has blessed you, you have conceived, you have become pregnant. We have heard this, and I've heard comedians actually joke about it. Is it true that sex hurts the baby? And also, it's not true.
Not true at all. So actually,
we had that week. He keeps hitting.
It's one of the.
For women who are not in the mood.
That's right.
There's also those ones.
That's right. You know, actually, Pumla is right. When you cancel, you realize that women, when you talk deeply, you know what, this guy, I don't
He's going to have the baby.
Yeah, he's
too much.
So when you have a time, you get a time when you can speak to the woman alone. Say, okay, I want to examine. And for those husbands who are not so protective, say, okay, let me excuse you guys, and you can ask, but
what is the problem?
What is the issue? Is that you know that baby, yes, in Chimanyi na you. Usually there's something, it's the headache that Pumla is talking about. Yeah. It's the headache equivalent. So yes, it's not true that babies are being hurt. Actually, babies are very well protected. But something happens to some women during pregnancy. Sometimes the libido goes down, sometimes the libido goes up. Sometimes men are misbehaving and she's not in the mood.
Got it.
So they'll find some kind of excuse to say, you know what, this, you may hurt the baby. But we also have men who fear. The woman may want, the guy just fears. For one reason or another, says, I may hurt the baby. So they usually do it out of ignorance. So they say, no, you know what, you're not going to hurt the baby. The baby is well protected, and whatever you do so deep may not reach the baby at all. So they need to be comfortable that sex is healthy in pregnancy, at least for most pregnancies. There are a few exceptions where we say avoid sex. But for most pregnancies, it's very healthy, and we encourage it.
Okay, so in line with pregnancy risks, what are some of the common pregnancy risks to look out for, and how can pregnant women safeguard themselves from those risks?
Okay, well, that's a whole...
So I know it's an entire show.
It's like a course. But yes, so the risks that are related to pregnancy depend on the person's individual risk. Usually there are women who are at risk of high blood pressure in pregnancy, and risks of having high blood pressure in pregnancy are many. You know, if you're, for lack of a better word, have a high BMI, or you have a little bit more fat than you should, you are at risk of having high blood pressure. When you get pregnant older, when you're age 40 and above, you're at risk of getting high blood pressure. If you get pregnant too early, when you're less than 20, you're at risk of high blood pressure. When you have chronic high blood pressure before you get pregnant, you are at risk of it complicating in pregnancy. You're at risk of diabetes in pregnancy. So a lot of those things are assessed on an individual basis. So we'll have a woman come through and say, okay, I'm pregnant. So, okay, what are your individual risks? Hey, my mommy had this, I had the other thing, I had this. So depending on the individual risks, yes, like fibroids, then we'll say, okay, your risks are this and that, and this is how we can reduce them. And then we'll offer you some drugs, treatment, folic acid, aspirin. You'll hear those kind of things, so that we try to mitigate the risk downwards. But there are many risks in pregnancy that I've just mentioned one, high blood pressure. But there are many: birth trauma, big baby, very small baby, your water breaking too early. Your water breaking too early, or you getting into labor before time, having preterm birth is also a risk factor. There are people who have a weak cervix, and therefore we need to put a stitch to kind of hold the baby in. There are very many kinds of risks that are related to pregnancy.
As there are women.
Everything about us is complex. Inside,
outside.
But I have a question that is not a medical question. How do you know, I looked at your pretty wife. Oh, by the way, his pretty wife is somewhere over there.
Very
population will come and just
wave at us.
And it's a question that
he's even drinking water.
That's how he knows where we are going.
But let's go. It's a
question I've always wondered about. How do you separate? Because to you, that area, even if you're cognizant of the fact that there is more to do with biology, that vagina has more to do with, is more than biology, biological. How do you separate your GYN professional self at work from your husband self who wants to please and satisfy and give pleasure to his wife? How do you, because the one part, the organ is the
really
same.
My
I'm struggling here.
But I get the question, Pumla.
You get the question,
Yes, I get what you're coming from.
Because I have actually, let me tell you, I think a gynecologist you work with, I used to work with Dr. Sekoyama, was supposed to be my GYN for Teja, for my son. But I had known him before. So in my mind, I was like, what? So I asked him, please, I had a consultation with him. I said, please take me through everything that is going to happen from the time I start seeing you till delivery. When he told me that he has to put his fingers inside my vagina to check how far I've dilated or to see if I'm able to give, I said, I'm sorry. It can never be you. Because I know it's too personal. So I
So how did you know his hands? Huh?
Oh,
okay. No, I was just wondering because it's a long process between that. Okay, but
I asked at the beginning and he told me
everything that was going to happen.
The whole 9 months and when I give birth and everything. And I felt it would be too personal.
And it's interesting that you're saying that, sorry, we're going to disturb you with this question because we're dying with it. When we were choosing a gynecologist, I knew the gynecologist and his wife. We are friends, we talk to each other, all of that. Not that it didn't bother me. I asked him, I said, Sebo, tell me how we are going to separate my vagina from her vagina. Brian was so embarrassed.
I'm sure he was.
But I needed to know. So I kind of have a feeling the answer will be pretty close to what you're going to say.
Yeah, no, for sure. So what happens is, so one is a profession, the other one is the wife. Okay, so what happens?
It's not obvious, please. Haven't you ever gone and seen some really nice vaginas and you're like, hey, my wife?
No, we have not.
No, that has not happened yet, but...
Your husband wants to hide.
So the thing is...
what does that mean?
So
like, I hear you say, but I don't know what it means.
No, we have seen, by the time you like practice for example, I've delivered over 2,000 women. To be honest, I may not remember the last vagina I saw. To be honest, so which means this is a job. So we come, it's almost all the same, really.
Yeah.
The difference, really? Yeah, it's almost all. So there's a lot of importance attached to that area.
Okay.
Yeah, and I have a friend who says, you know, it's almost all the same. It's just the face value you attach to that area.
Oh wow, that's a good one.
Yeah, so it's just the value you attach to that area. But for us, we actually see it's almost the same. I mean, if it's not diseased and there's no swelling here and there,
all factors constant.
All factors constant, it's the same. So that helps us to. I mean, I don't distinguish. I can't look at you and say, that chick was so... No, not really. Unless there's something obviously abnormally grown.
Yeah.
But if it's, I mean, all factors constant, it's the same. And for us, it's more like it's a job. So we come and, I mean, and many girls take it, or women take it to another level. They're going to see me, especially people you went to school with, or people who know you. They take it to another level. And you're like, you know what? It's actually the same. And I'm 99% sure that it's not going to be different from so and so, so and so, so and so. So, I mean, there's nothing you're going to show me that is going to wow me or shock me, because it's pretty much the same. Yeah.
Okay. Then after that you go and say, but Alexandra.
My wife's of course is special. Because there's a value I attach to it.
Yeah.
All right. Yeah.
So, doctor, I think one of the reasons that women are shy and fear or have anxiety around coming to the gynecologist is that maybe there are some bad apples, you know, amongst gynecologists who could take advantage in the name of work, you know. So how do I know that I'm being abused, or this doctor is taking advantage of his access
to
abuse me? He may defend himself by saying, I am working. How do I know, and how do I safeguard myself?
Oh, wow.
Yeah.
That's
Yeah, but it's a good question, because in every society there's always a pervert. There's always a bad apple.
Yeah.
So even amongst the gynecologists, you cannot put your hand out and say there can
none.
never be any gynecologist who can cross that line.
Yeah.
Because yes, there may be some unprofessional professionals who happen to be gynecologists. And this time they have easy access, as you said, have very easy access. But that's not to say there are no patients who also do the
That is also true. That is also true.
So, but sticking to the gynecologist before we get to the patient. Yes, so there may be, so how do you know this gynecologist is being, you know,
inappropriate? Yeah.
So you come and your symptom is somewhere different, but he insists on
doing an examination.
Down. And I mean, it happens many times. Everything may lead to another thing, but you have to be careful, because even when we need to look at that area, we often ask for permission to say, is it okay that I check? And even if you think it's utterly important to check that area, the woman may say, no, I don't want you to check. and it's fine.
Don't
you have to
insist.
respect. You know, you have to respect her wish. But then you find a few people who can be unprofessional. They do unnecessary examinations, and so I mean, there's this gynecologist in South Africa in a city called George, who was convicted of inappropriate touches or examinations with patients, and this is something that had been going on for so long. Because women are very vulnerable, and when you come to a gynecologist, you're even more vulnerable.
Yeah.
This took long to come out. It took maybe about 10 years.
What?
But it's until one person said no, it's enough. Then when they mention, someone says yes, me. So then it came out, and then this guy had to be, you know, disbanded from a medical practice. Yes.
Yeah.
So I mean, these things can happen. They can happen, and we are usually cognizant of that fact.
Yeah.
You know, sometimes when we see particular women, especially Muslim women who come with their husbands towering over them, we usually try to make things always, you know, because the men are very suspicious of gynecologists, saying, no, I have to be there. So, okay, that's fine. We can examine. You enter the room, and, you know, she's almost wants to be naked with her husband there to see exactly what you're going to do with the wife.
Okay.
Yeah. So, I mean, if it happens, it's not allowed. And if any woman feels her doctor is inappropriate, you're very free to change a doctor. You're open to change a doctor. You can report that doctor.
I agree.
Sometimes
Where?
it's difficult to
Report
prove.
Where? What, is there a reporting authority?
Yes, there is. There's a medical council you can write to, which can be able to review the case. Now, if that case will go through, and that's why many people are frustrated, because doctors can always find an excuse. As for me, she told me she came with A, B, C, and D, and it will look obvious that, you know, I had to examine. But even the way you examine, you say examine, but examining may be different.
Yeah.
Some examining may involve other things, but you say, for me, I examined the best way I know how.
Yeah.
And it's hard to prove, like there was no camera there.
Yeah.
Yeah. But also we have these patients coming to us a lot. Say, you know, doctor, I have this discharge. You treat her this week, next week she comes with the same discharge. Yes, she's smiling. You know, when you look at a patient, you're like, I'm
sure.
yeah.
May I have a friend, and
So
she
you-
honestly said this. She got a mini orgasm when she was being examined, and that time she actually had a condition that needed to be reported. She went back every week after.
I think she's the same friend of yours of school, university, who used to go to
Different people.
But
but then she
Pumla,
got
your
Pumla's
friends.
friends.
First of all,
Pumla,
the
your
guy
friends.
was handsome, like Dr. Kisuule.
Okay.
So,
Doctor-
so immediately when she felt a certain kind of way, then he examined her, they treated her condition, and she was good. She
Nah,
went
yeah.
back. For 4 weeks after, like, we literally had to cancel her.
Same results?
Yeah, like it was so, it was pleasurable. Like the examination was so pleasurable. Where Rachel grosses out at the fact that you enter, but like it's so evasive.
That's what she
For
wants.
her, she kept going back.
Yeah.
But
Until
also,
like
yes,
literally
yes.
we had to sit her down and cancel her and say, excuse me, please
You
stop.
can't.
And
Hi,
she,
go in the I know you're watching.
and she shared this with you, right?
Yeah, because we are free, we're open. So it was something.
She
that
was like, when I
just
met
saying,
a guy in,
And
day.
Please note, someone else went there on her recommendation also.
Okay,
So
okay.
it's a thing, I get it.
Yeah.
Okay.
Yeah, because I mean they come smiling but with symptoms, and you're saying, but this because someone is complaining, I'm doing this and saying, I have this discharge. I don't know if you want to check it. So you're saying, okay, I don't need to check it today. Doctor, are you sure you don't want to check it? So I'm like, yes, I know exactly what it is. I've treated it before, but I'm going to treat it. No, doctor, I think you need to check it before I leave. Yeah. So I mean, it can happen. So we also have to
That she has sexy loves already this time.
we don't know. We don't know if it's sexy, but I mean, sometimes they come the way they come.
Okay. The way
yeah.
they came, the way.
Yeah,
okay.
and a lot of it with makeup, lipstick. Say, this person who's lining up in a hospital to see a doctor because of this very big symptom.
Right?
Yeah.
You're like,
Ah, okay, well, I think this has been, personally, I feel much more informed, much more enlightened.
Yeah.
I feel so well educated now
Yeah.
about reproductive health, and I'm sure everybody out there, our audiences, you feel a little bit more empowered about what's really going on through your reproductive system.
Yeah.
But if you ever have any issue to do with that whole system of yours, don't ever be afraid to go and see a gynecologist. Don't ever. And if you have questions for us that you need, for any GYN, by the way, Dr. Kisuule, Dr. Kisuule will be helping us in the comment
We can
section.
make it a 6 course.
Yeah. So if you have any questions, and if you have even more, you can share them on the comment section, and then we can invite Dr. Kisuule here again to answer all those different questions.
Yeah.
So thank you again so much, Doctor, for
You're
being
welcome.
here with us. It's been amazing. It's been great. I can't wait for us to host you again.
Yeah.
So
Thank you.
until next time, with love from Bump Love.